Welcome. This is Jean Eaton of Information Managers. I'm delighted to have you joining us for the Practice Management Mentor interview with Bruce Lee. I am your host, Jean Eaton, the Practice Management Mentor with Information Managers. Practice Management Nuggets is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can focus on providing quality healthcare services. Today, our guest is Bruce Lee, who is an event speaker, productivity coach, master of ceremonies, and author. As a former business owner prior to becoming a full-time speaker for over the past 24 years, Bruce brings a hands-on approach to productivity and employee retention issues and has contributed to high-level healthcare training for the last 9 years. His passion is working with hospitals, clinics, healthcare organizations, and their staff by offering real solutions to the current challenges through high-value, what-to-do, content-rich information and real-life situations that audiences can relate to. Bruce, it has been wonderful to have you back. You have a wealth of information and lots of new things to share with us. So today our topic is the 7 moments of truth in patient clinic satisfaction. And your leading quote, Bruce, is, "I am the patient experience." So tell us, how did you get here and what are we going to learn about today?
Well, the exciting thing behind all this is, as you may know from previous sessions, from working with custom learning systems and having been involved in healthcare training for the past 10 plus years and training in general for 20 some odd years, that we really figured out that when you have an engaged employee, there's a number of benefits to it. The bottom line is you get an engaged patient. And when you have that, some magical things can occur because you're going to get better adherence to medication. You're going to get to the point where they're going to recommend you if that's important. They're going to come back. They're going to be happy. Happy patients heal better. Happy patients have better staff. It's kind of a circle that when you can get that going, it's pretty exciting. But it all revolves around the word engagement, and it's at the staff level and it's at the patient level and what it takes to get there. As the slide is showing, what I like to talk about when it comes to most healthcare patient satisfaction staff development workshops is that the vision of making your clinic or your hospital the best it can be, and ultimately it's about creating that world-class patient and family experience at your medical home. And by world-class, we just mean best in class, and providing the ultimate patient experience you can at every step along the way. And as you heard me talk about in the last session, from having delivered CGCAP's workshop at a patient experience conference a couple of months ago, that it makes sense when you understand what questions people will be asked to rate their experience of the provider and the staff. If you know what the key questions are, you can then use that in your process improvement meetings or clinic process, whatever you call in your internal service to improve anything that you can get better and get excited about getting better and making it a lot easier to do your job and be the reason you're there. So what I like to say is, to a large extent, any educational format is really a team building event, but it's understanding that as Michael Jordan said, talent wins games, but teamwork wins championships. That literally everybody within the clinic was hired for some sort of strength and expertise they have, but together it's important because to the patient, you, that employee, are the clinic, and that reputation is based on how well you do the job. And when I say, well, how can you make that one-on-one experience just a little more meaningful and relevant and maybe even exciting and memorable? So, and the reason for that is when it comes to healthcare these days, expectations of service and the quality of care keep going up. So you need to keep raising the bar on what you do.
So having the quote about the I am the patient experience, if the staff person takes ownership of that and says that I am the patient experience because the patient that's in front of me right now, from the patient's point of view, you know, I am representing the entire clinic. So I have a really important role to be able to represent the entire clinic and be the best that I can be to provide this to to the patient. Is
Yeah,
that right?
exactly. Because while you may have this hierarchy of different levels of employment and management and frontline people, ultimately it's the person in front of you who is that core provider of that service at whatever level. And when people know that whatever they do within the clinic matters to the patient, that's important. And that's what I try to get across when it comes to really creating that engaged employee is how you connect with the patient and make them feel important and help them understand that you're there to help them and give them what they came there for.
Okay.
So it's all about engagement.
Walk us through this, Bruce.
What's that?
Walk us through this.
Yeah, well, we'll skip the next one. So it's really about creating an exceptional patient experience every time. And that's just, that's ultimately saying is, how can we do that? So if you want to skip to the next slide, one of the things I like to talk about is really about accountability questions. When it comes to the clinic, there's 4 key questions I like to ask, which ultimately gets to I am the patient experience. Number 1, are we holding our people accountable? What that means is for what they do and how they do it and how well they do it. And so are we measuring what they do and the results they get, good and or bad? Or are we holding anyone accountable? And all that means is if nobody's accountable, no one's responsible. And so you need to be accountable for the job you do, how well you do it, every single step of the way. The second thing is, if you actually do measure your patient satisfaction, what do you do with the information? Who do you share with? Do the providers get to know how they do compared to anybody else? Do you know how you do compared to your city competitive clinics, or to Alberta or to Canada? And if not, why not? So when you want to know how you did, are you first place or are you last place? What do people think of you? So do we really measure the experience? And if we do we share it? Because that's when you really start creating an improved environment, when people know how well they're doing and where they're doing poorly. And a lot of organizations do measure, but they don't share the information, and so it's meaningless. The third thing is, how well are we connecting with our patients? Do we really help them along the way? So, with the advent of patient navigators these days and patient portals, are we really helping them get all the information they can? The new trend, I think we talked about it last time, was how patients are being given their medical records at every step of the way. And when you get that type of transparency, you get better adherence to medications and at all levels. So how well are we connecting with them with the newest trends that are going on? And the last thing is, I think it's really important, and I get quite excited about this, because whenever I do, I'll just say generic, not-for-profit, corporate business, chamber of commerce presentations, I'll say, if you want to know how to get better, do some focus groups, do a SWOT analysis. When it comes to something as important as health and healthcare, are you really getting the patient involved in your meeting? And literally, anytime you have a meeting that's going to be involved with something to improve the patient process, you better have a patient in that meeting, because otherwise it's meaningless. Because how do you know how it's going to affect them? Because their insights, being the patient, may be a heck of a lot different than you as the provider.
So don't make the assumptions that you know what the patient wants. Have a patient there to represent that audience group and that perspective.
Yeah, and you're going to get so many insights, and if anything, it's a validation that what you're doing is correct, and it gives you greater emphasis to do it.
Excellent.
So goal.
Okay, so that brings us to
so the ultimate goal is the engaged patient, and that's what we're talking about with all these different things that are happening. So the question is, when I do a live, people go, so why is patient satisfaction important to you? Well, there's a lot of reasons for it, and especially when you do a kind of little workshopping on it. First of all, it's the right thing to do. I've heard doctor after doctor say that, but the staff go, yeah, it is. Because we want to have that satisfied patient. It's easier to serve the patient. Our community deserves it. And ultimately, the patient gets better faster. And the cool thing about that is when we really work with them and we feel better, the spin-off to us is huge when we understand what that's about. We're meeting the expectations consistently and having some good events with that. So ultimately, it's what would it mean to our clinic if everybody understood what that looks like? Well, that's why when I say we, and I'm talking about Brother Brian and Custom Learning Systems, we have a little sheet that we work off of called the 7 Critical Moments of Truth in either clinic and patient satisfaction. In a physician's clinic, same thing. I'm just changing the terminology a little bit here. But it's really saying is, what are the key measurements we should be doing when it comes to creating that great experience for somebody who's coming in? Well, we'll start with how we answer the phone. And do they get the appointment on time and as quickly as they need it? Do we have we created the opportunity for walk-ins and appointments like in the next hour, or instead of a week or 2 weeks later? When we actually do have them there, it says patient wait times. Is the time frame less than 15 minutes in the reception area, not the waiting room, before they go into the exam room? So do we keep it really short? And if they are going to be spending 15 minutes in our reception area, are they entertained? Are they comfortable? Are they made to feel welcome? Is it a great environment? Period. When we're dealing with them at every step of the level, instead of coming out and saying, Bruce, are you here? It's coming over and saying, Mr. Lee, we're ready for you. Can I help you? Just being nice, treating patients as family and friends, the way we want to be treated. So, do we provide some sort of courtesy? Are we responsive to any needs they have? Do we help them if they're having some issues? And, that sort of thing. After the exam, whether we're waiting for the test results, do they get them immediately? And are they meaningful? And are they posted on our website? And are they monitored as to what the information is so people can get it immediately, either by us calling them or by them going online and checking the results? And when they do meet with the physician, what is his or her skills and personal manner? They give enough time to talk and get your questions answered? And do they show you, turn the computer screen around to show you what's going on, and you get a chance to read it while you're waiting? And so do you really make it transparent as to what's going on? Because when you start doing that, that's when they get that greater adherence to what they're being asked to do. And what I find really interesting, you say, by the way, if you see anything wrong in your write-up, let us know so we can update it, or maybe you just want to update it. And as you may know, in the U.S. right now, a lot of states are making it okay to give the patient their medical records, which means there's no privacy laws. And that's going to change how people do things, because when you have your own records, you can do with whatever you want. So if you start posting them on Facebook, that's okay. And the last thing is just kind of the overall office appearance. So when you know that the key things that people are going to compare you to and from, then you can start training in your weak areas and making it better and exceeding the expectation when people come in, and maybe even surprising and delighting them.
So there are a number of things that we can take a look at to make sure that we're doing a good job.
Yeah, and that's what that form looks like that we hand out in most of our workshops. We call it the 6 Secrets of Creating World-Class Customer Satisfaction, but so be it customer, internal, external, patient satisfaction, same terminology, but simply saying is that everybody's a customer of somebody else. But we're saying there's 7 key areas. If you're having some challenges in 1 or 2 of them, well, start working on those and start doing the focus groups and start doing a SWOT analysis if you want on what happens if you don't do it, and what can you do, and how you can make it exciting, how you get creative, and and how can you improve the experience. Bottom line, most of it won't cost anything, but the payback will be huge. So the question I always say is, what would it mean if everybody understood how important they are in each step of the way, and to make that difference? Because we get so involved working in the clinic as compared to being the visitor for the first time. What can you do to make it exciting? So like maybe when you walk into the clinic, you're greeted by name and say, "Oh, you must be Bruce. It's 9 o'clock. Nice to see you." And chances are it won't be anybody else. And having chairs that are 6 inches apart, so you're not elbow to elbow with somebody else, and having something really entertaining on the screen, having good lighting, and just all these little things you can do to as if somebody's coming to your house as a guest, and making them feel welcome, because it's important for them, especially if it's a first-time visitor. Do they get proper directions about how to find you and get there and pay for the parking and the whole gamut of things for the first time? visit to your clinic. So just how can you really make them look forward to it and not dread it, or have some form of a dreaded anticipation of it because they don't know what to expect. So are we really their partner in that experience with us, and are we literally holding their hand to calm them, or to reaffirm that they're going to have a good experience and get what they're coming to us to visit us about.
Okay. So we have a lot of opportunities to improve that patient experience. The staff can be engaged and take responsibility, and great things happen when we do that.
Yeah, I say it can be little things, like having pet therapy while they're waiting. If people aren't allergic to animals, or a fish tank, or nice music, or seniors bathrooms in your public bathrooms. A lot of little things you can do to just make that experience just a little bit more inviting, every step of the way. And that's where you can get your staff and get really excited about it, going, well, yeah, what can we do better? So what we're looking at now, the medical clinic cycle of service, is just an expanded version of the moments of truth that there are in a clinic visit. And where this concept, moments of truth, we've all heard about it. A moment of truth is, the definition for it is anytime someone comes into contact with you, with your facility, and from that contact makes a decision about the quality of the service and or product, and if they'll do business with you. And we like to say, so however many moments of truth there are within you, your clinic, the visit with you, how do we reward the person for that experience? That just means doing the contact the best they can. For example, if they're coming in at 10 a.m. and by 10:10, the provider is going to be late, do you communicate that with them and give them an option to see another physician, or to come back another time, and reward them by paying for the parking, and acknowledge the inconvenience, or do they want to wait, and really being kind of consultative with them about what that change may be? Because when you can communicate the change in the expectation, and that's when you get that cooperation, and people respond better. And the reason that's important is a lot of times people make appointments and they have a really tight schedule, and if there's a delay, that's when they get antsy and they start complaining, and you start getting those issues. So it's just saying, okay, if I was sitting there, how would I want to be treated? If that was my family member, how would I want to be treated? If somebody I knew wasn't feeling well, and they think they got something really wrong with them, how would I want to console them and soothe their complaints? And so what sort of experience would I want? And this is just a good example of the moments, and there's a lot more moments in here, because it's really saying, well, how do you get to the clinic, and how do you get up the elevator, how do you go up the stairs, and where you pay for parking, and where are the bathrooms, and there's a whole lot of other moments of truth, which you're not responsible for all of them, but you can sure pave the way for a better experience.
Okay. Bruce, I want to go back for a moment. You said the moment of truth. Tell me again what that is. It's when the patient makes a decision?
Yeah, well, the technical term for a moment of truth is anytime the patient comes into contact with you, and from that contact determines how good an experience they're going to have. So a moment of truth could be when they call to make an appointment. Moment of truth could be when they get that appointment, the time schedule is appropriate what they want. Next moment of truth could be if they haven't been to your clinic before, do they know how to get there? Do they know where the parking is? Do they know where the paying is? Those are all moments of truth. Or when they get in the building and you say you're on the third floor, where on the third floor? Where do you turn when you get off the elevator? Or where are the bathrooms? Or when you come in our clinic, where are you going to see our receptionist, and what the expectation is. So literally any contact with them is a moment of truth. Now, and we can make it memorable. I was recently down in Long Beach, California, doing the CG Caps workshop, and I had the opportunity to go to Disneyland after, and had an amazing moment of truth where I went up to one of the rides, and there was a huge lineup, and I couldn't figure out where you got your pass to come back at a scheduled time. And so I went up to the person who was at the door, the entrance to it, and I said, where do I find my fast pass? And she goes, it's just one of you. And I go, yeah. She goes, would you like to go in now? And I go, of course I would. So that moment of truth exceeded my expectations by hours, because I was able to get in there immediately and have a fabulous experience. And that really colored my entire visit, because it was a great first contact. So
I like how you said that it colored your experience, that having that one opportunity, somebody went above and beyond or simply answered your question in a reasonable and positive fashion.
yeah. And what made it even better is about 12 hours later, my last ride I went to, again, there's a huge lineup. And so I went to the person who was in charge of the line, and I said, is there a fast pass, whatever? And he went, one of you? And he goes, just go to the front of the line. And I didn't even wait. And I go, what a great last moment of truth, because, at the beginning and the end of the day, somebody said, we're just going to treat you as special, and didn't impact anybody else, but it made a huge impact on me about how I felt about it. And that's really what that is. So when we get into the slide you're on now, which is called the cycle of service, it's really saying is that which of those moments can we impact that person by that. So the cycle of service just is the whole gamut of from step one, the call, to step two, getting the follow-up call to the test results.
Okay.
And our whole life is moments, and when you make it special, the first kiss, the first date, the first dog, the first birth, first girlfriend, first boyfriend, you go, we all, first love song, we just tend to have some sort of fondness about those ones that are really positive, and that's what we really want to create with the patient, is because they want that positive experience, and we just need to remember that that's why we're there. So the team do it recommendation is simply saying is when you understand what the questions are, which are coming up, the key questions, and we'll just cover them very quickly, is that when you know what the questions are, you can go, well, so how can we create that moment? How can we improve our cycle of service? So in our improvement meetings or process improvement meetings or just even our daily huddles, here's the issue, here's an example, here's what we learned from the patient, how can we improve the process, here's what they complained to us about, here's what they compliment us about, and train on the weakest point is really what that's saying.
Okay. All right. And then we go to
yeah. So where I just want to spend about 5-10 minutes on this, and kind of the critical part behind what this session is about today, Gene, is that Custom Learning Systems, my brother's company, about a year and a half ago, created what's called the HCAPS Breakthrough Series, which is a webinar series. And while this is U.S. based on HCAPS, which is the federally mandated system for measuring every single hospital to every other single hospital, there's a number of core domains or key questions that patients are asked to rate the healthcare consumer assessment of the hospital experience. And from that, if you know what the question is being asked, you go, so here's how we can be proactive to get the result we want when we know where we're our weakest at. And so as a result of that, it's now spread to clinics and ambulatory and emergency and long-term care. So if you go to the next slide, the one that I'm specializing in is called CGCAPS, which is clinics and groups. So clinician groups, consumer assessment of healthcare providers and system surveys. And while it's not mandatory, unless you have 100 providers, it's really saying is, if you want to improve the clinic experience, here are the domains, and we're going to just show you some questions real quick here, folks. When you understand what the question is being asked is, how are we doing on our own? Even though this is U.S., it still applies. It still applies to us. So, for example, under domain number 1, timely access, the question is, in the last 12 months, when you phone this provider's office to get an appointment for care you need right away, how often did you get an appointment as soon as you need it? Well, if that's the question being asked, and you always want to go to the always, which is called top box, that people are always checking off, yes, we always got it as soon as we wanted it, whatever that is, then you're doing great, because that's what they're recognized and rewarded financially for, is by being in what's called the 90th percentile of top box. And that's what you want to accomplish, so if that's the question. So what we did and what I did in this workshop is to go, so why does it matter to the patient? Why does that question matter to the patient? Why does it matter to our clinic, to our facility? And what have we just started doing? Well, when you start saying to your group, what's the benefit? Start listing them. You go, well, this makes sense. If this is a benefit, then why wouldn't we want to support that? And if you look at what's listed here, there's some pretty good reasons why you want to do that. Basically, it's about saving time and energy and improving the process. And and there's a lot of benefits to that. So the next slide is some of the best practices. And I'm saying, well, if it's a best practice, are we doing it? You don't have to invent the wheel when this information is out there. Simply saying is, how can we get better? How can we be the best we can be? How can we be known for being for excellence, which is what you want to be? And again, these slides are just showing some of those other ones. And just as an FYI, if you want to go back to this for a second, I always find interesting that the phone call is so important. I recently phoned a clinic, and the message for the long weekend wasn't turned on, and there's no direction about how to really contact anybody appropriately to that day. And it's somewhat frustrating. So I say, so if you do have an answering service, you do have an answering machine, is it really saying, here's how you get hold of us 24/7, regardless of what's going on? And that just means making sure you educate your answering service if you have one, or that the most appropriate part of the information you want people to hear on your message is the first part, not the last part. So just really looking at how are we making it easy for the patient to do business with us? And are we giving them the most important information first? So next slide, thank you. The other thing, so tying into that is just, so again, some timely access tied to that, and they're here for you to look at. And it just makes sense. So anything we can do to improve the process, improve the line management, is all the better. Bottom line there says effective communication skills taught on error identification and calming, and we call it mess up, fess up, dress up. That when you do when you make a mistake, you acknowledge it, do something about it, and just some other cool stuff. Next slide, please. So the second question, the domain was medical questions answered same day. Again, this is crucial. When people have an issue, they want to know right away what's really going on for them. So the question that's asked is, in the last 12 months, when you phone this provider's office during regular office hours, how often did you get an answer to your medical questions that same day? Again, you want to go top box always. So what's interesting about this, they may have a medical question, but the physician doesn't have to give the reply. They can give the reply to your nurse or LPN or receptionist to give the information back. Statistically, only about 20% of questions need to be answered by a physician, and somebody else can. But you need to make sure that the questions are passed on to the physician in between appointments, so there's no time delay. Next slide. And a lot of other best practices for that. Client wait times. This is important because it includes the waiting room. So I like to call it the reception area and the exam room. And the question says, in the past 12 months, how often did you see this provider within 15 minutes of your appointment time? I know when I go to mine, it's usually 5 minutes or less, and I feel good about that. And the exam room is maybe 5 minutes, which means they're organized. And that's important, especially if you're on a tight time frame. And that's the objective that you should always have, is in and out in a timely manner appropriate to the person, and getting everything, getting their questions answered, prescriptions issued, whatever the need for them is. And again, you want to go top box always. So what do you have to do to be organized to do that? We have to have some flexibility. Next slide. So staff responsiveness, I always think, this is the core moments of truth, and that's why it's highlighted in the yellow and the asterisk there beside that. So during your most recent visit, were clerks and receptionists at this provider's office as helpful as you thought they should be? Well, what would that look like? So when you're there, is it being attentive to you? If there's a layer, they're communicating that to you, or they're making sure you're comfortable. Just communicating every step of the way what's wrong. Is it easy to see them when you walk into that, or do you have to look over this 4-foot high retaining wall to get at somebody who's always on the phone? So are they helpful? Well, that's the question. As helpful as you thought they should be. Well, how do you know what that should be? Well, that's what we need to ask them. And again, you want to have the first one, the top box, which is yes, definitely they were there for me. Next slide. And it's kind of tying in with that, which gets to the next one. It's really about how well we communicate, because that's all we have in common with anybody else. So question number 5 is, during your most recent visit, did this provider explain things in a way that was easy to understand? For me, that's important, because I don't understand most medication terms and medications. I don't need to, because I'm not involved in them that often. It's not my normal day-to-day terminology. And I'm pretty sure that other people would have even more of a challenge with going, well, you're telling me that, but what does that really mean? What do I really need to do? So just telling somebody something doesn't mean they understand it. And that's why you need to say, tell me what you're going to do. What does it mean to you? Let's make sure we're on the same page with what the instructions are, what your medication is, what the protocols are, what the follow-up is. And so when they say it back to you and they get it, they go, okay, so that's what I will do. So just telling somebody something doesn't mean understanding. It certainly doesn't mean compliance. So that's why that's important. Again, you want top box, yes, definitely. And the follow-up to that was, during your most recent visit, did this provider spend enough time with you? And we know that's an issue. So you need to be effective on that. Test results, important, and I highlighted the word someone. Did someone from this provider's office follow up with you to give those results? Nothing's worse than waiting to get information back after you do some tests, and you go, well, nothing was wrong, we didn't call you. Oh, really? Is that what the process was supposed to be? Ensuring people understand the test results were what they were expecting and what they might want to do to ensure. So just that timeliness after is so important to everybody, to reassure them that things are okay. Next slide. And overall rating, so not important to us, but just from a self-satisfaction point of view, in the U.S., every hospital is compared to every other hospital. And clinics will be that way too. But using a number from 0 to 10, where 0 is the worst provider possible and 10 is the best provider possible, what number would you use to rate this provider? Well, you want 10, certainly 8 or above, because that's when you get that raving fan. That's when you go, that's the person who's a champion for you. Something may have gone wrong, so anything over an 8 is great. Anything less than an 8, you're not doing well. In reality, because it might be generous in the context of, well, who's going to see this? And, I really like this person, but this person wasn't good. We get that all the time. And the last slide, when it comes to the core questions, is willingness to recommend. And again, not necessary to understand that here in Canada, but just when you look at, would you recommend this provider's office to you and your family? You want to be knowing that people talk about how good you are. And again, top box, yes, definitely. So, Gene, so that's kind of the core questions behind it. And I just think, if they're doing that in the States, at some point in time, it's going to happen here, because Alberta Health Services, for example, is using HCAHPS, but they're not publishing the results. And I'm going, if you have these resources available to you, why not use them? I've seen some clinic survey forms, and they are adequate at the best, but nothing's done with the information. So I just like to say, let's dig a little bit deeper and go into, well, how can we create that moment? How can we manage that moment and exceed the expectation? Just make it a good experience.
I like the idea of the questions and being able to provide a survey, and it doesn't even have to be. There are good reasons why we want to have it in writing, so we can gather some data and see that we're doing better. But even if you had a poster for the day to say, this is the question we're going to ask people today, so that you're engaging people while they're there face to face, and you're only asking one question. You're getting an immediate response from the patient to say, did somebody get back to you about your test results last time you were here? And then you've got an opportunity to have a discussion right there, right then. So you can engage patients using these questions in lots of different ways.
Yeah, and it's interesting when it comes to where I want to go with this. I've got I don't think the next slides. I didn't send the slide up, but just I have one prior to this. I just want to share. A couple of core employees with AIM here in Alberta Health Services, after a session about a year and a half ago, said, we're not selling health in healthcare. We're selling a relationship and an experience. And I'm going, that's exactly what we're talking about. Nothing's more important than our health. Nothing's more important than getting better quicker, whatever the issue may be. So we need to have that timely access and get things checked out so people will feel better, because when they feel better about themselves, they're going to be a lot healthier instead of about worrying about things. And that's why that's important. So as we start to kind of wrap this session up, one thing that is important in every single step of the way is the quality of the communication we have with anybody, because that's all we have in common with somebody. So when it comes to some core concepts that I want to share with you right now, it says, number one, have I shared a story today of my patient experience, good or bad, in my meeting? If you're going to be having a meeting about something, why not share what actually happened with a patient, good and or bad, so people know what you did well or did what you did poorly. And if you did do something bad, what are you going to do to make sure it doesn't happen? And if you did do something good, how can you enforce that, reinforce that, I should say. Number two, to actually listen to and hear what my staff and community are saying about me or us. That becomes an interesting question because, depending on who is being asked this question when it comes to the leadership team, be it your position or your clinic manager or executive director or whomever, what's really going on that we should know about, and are we paying attention to, and would give time and energy to it to read, fix, correct, do. Number three, are the problems I hear and read passed on to our rapid cycle improvement team? So whatever you're calling your process improvement team, which is the next one, are we really saying, okay, we know there's a problem, how can we fix it so it doesn't become a problem again? Because if it's a problem now, it'll always be a problem. We need to stop it in its tracks. So what can we review, follow up, and make the correction? And then the last question, which supports what I talked about before, but not just focus groups, but do we have a patient on our process improvement teams? So if we are going to make improvements, do we have the voice of the patient with us, and are we listening to them?
Okay.
So the question I like to ask is, we were down at the Barrel Institute in Dallas a couple of months ago, and they do a big thing on the patient experience. And one of the things I really thought was just nice to do, and I do it in all my training sessions now, is I go, so we're talking about who is the patient experience, or what is the patient experience? So I put down, well, who creates, defines, supports, maintains, engages, and who ultimately is the patient experience? Well, it's you. Every single contact, every single moment, you are the patient experience. And what I have people do is I have them fill out a 4x6 index card, or recipe card, wherever you call them, and say, well, if you believe this, actually fill it in and sign it. I am the patient experience, or we are the patient experience, or our clinic is the patient experience, or we are the patient's home. We are the medical home, and however you want to experience that, and go, so when you put your name on it, you go, that personalizes it and makes it a little bit more meaningful. So the bottom line of this is, if you want to improve the moments of truth, you want to improve the cycle of service, you want to improve the contacts, create a better experience, create a better reputation, create a better office environment, clinic environment, then understand that you, the individual person, really is the patient experience. Every single person is important. Every single contact is important behind this. And, so the reason for this session, Gene, is simply saying, well, let's look at what the moments are, and let's not forget about them, and let's really focus on saying, well, did we do that well, or how can we do it better? What went wrong? Why did it go wrong? And how can we improve our process and become a little more productive and a little more profitable?
Having that communication is vital. We can't improve unless we know where we are. So we can't, aim for something if we don't know the direction that we're going at. I love the idea. I have a picture in my mind that you've put there, Bruce, all these recipe cards that have been written. I am the patient experience, signed every person who works in that clinic, and having that on the wall in the reception room, not the waiting room.
Thank you. And that'd be a great idea, because people go, what is that? And they go, that means you're important to me.
I love it. That sounds great.
Yeah, great suggestion, Chief. Yeah.
Okay.
So, with it being the beginning of May, a number of years ago, a friend of mine, Leo Peters, that's him, the gray-haired Santa Claus fellow there, who wrote a tribute song to nurses because of the great care he got from one nurse in particular. Was he went through a second bout of cancer, and like I say, it's Nurse Week coming up. You might want to consider playing it or getting it. It's on YouTube. That's the link to it. It's a beautiful song, very meaningful, and a pretty fabulous moment when you think about it. And
that's lovely. Thank you.
And we just finished Patient Experience Week, and Patient Experience Week means how can we improve the continuum of care? Resources I like to make available. Number of ebooks. Brother Brian produced one a little while ago called "Keep Your Nurses and Healthcare Professionals for Life." Some great stories in there. We have a generic customer service one. how to satisfy every customer every time, and just some really good stories. But really understanding that moment of truth is a core concept behind that. And I have a book coming out in about a month called Trust Me, You Won't Be Sorry. Why Trust is Your Competitive Advantage in the World Today. And of course, healthcare is pretty high up on that trust level, and a number of different articles. So engagement, which actually was recently just published in a national health magazine in the US, one on trust, besides the book, one on conflict, one on meeting mastery, which is some core ideas here as well. And the next slide is simply saying, as we click to the next slide, I recently put together a grouping of five, one too many, a grouping of five resources. They're US resources, but anytime I've shown them to clinics here in Alberta, they've listed them on their website for access by their patients, and just some really good background information to prepare patients for a hospital visit, or just a little bit of understanding of what they're being told and why it's so important. And if you want any of these, just email me. I'll be happy to send you one email with all of them. There's pretty cool things in there, and I'm happy to share them from the organizations that I found them from, and it will help your practice, your clinic for sure, because it's really good information.
So you've got a number of resources that you've brought to our attention, and the best way to reach them is send you an email?
Yeah, or call me.
Okay.
But email's good, because then you get the immediate email back.
All right. So Bruce Lee, speaker at shaw.ca.
That'll work.
Okay. Bruce, you have so much information. I am delighted to be able to have you on board again. I've got a whole notepad of things that I want to do. I really like the words about the moment of truth, and that we're empowering our staff to be able to take responsive and be actionable for that patient experience, that we all have that moment to be able to provide an engaged patient and to provide an excellent service for our clinic and for our patients, because we're in this business because we want to make a difference. So let's make sure that we give our staff the opportunity to make a difference, and to hear from the patients that, yes, you did make a difference. That's got to be so very important in each and every person's days.
You know, I like how you're saying that, because one of the things that I always like to get across is that healthcare providers at whatever level really do make a difference in the lives of people, and that and the whole concept behind this little session is that when you understand that what you do makes a difference, when you get engaged, you become a lot more enthusiastic, a lot more helpful, a lot more committed. Patients see that, they sense that, they sense your enthusiasm for the job, your passion for the job, your care for them, and the response is huge on their level, but the response within the clinic is huge as well, because productivity goes up, and that's the core. So for everybody who listens in today and who listens in the next week or so as it's made available, so thank you for taking the time to be a part of this, and but also just for your commitment to making a difference in the lives of so many people.
Thank you, Bruce. And we do want you to be able to share this information so that your coworkers and colleagues and other friends have the opportunity to sign up for the resources with Bruce and get all of these resources. Do share this practice management nugget information. It will be available on YouTube and Google Hangouts, on our website, and you've got Bruce's handout and his email information, so you can ask for him directly for his resources, and perhaps to lead or facilitate a discussion in your organization. Bruce Lee, thank you very much. It's always a pleasure to be with you, and we look forward to keeping in touch.
Thanks, Gina. I look forward to the next one.
Stay tuned, everybody. Take care.